Welcome to our Doc Talk video about hernias. Today I have one of our surgeons to answer some questions, and I'm going to ask him to introduce himself.
Hello, I'm Wayne Lau. I'm one of the general surgeons here at Valley, and I've been practicing here at VMC for 25 years.
Let's start with our first question. What is a hernia?
A hernia is a defect in the wall of the abdomen or the groin. Those are the most common places for hernia to occur.
What are the most common types of hernias?
The most common types of hernias are umbilical or belly button hernias, inguinal hernias, ventral hernias which occur in the upper abdomen, and incisional hernias which occur after a previous operation.
What are the symptoms of a hernia?
The symptoms of hernias can vary. A number of patients may not have many symptoms at all. They may just note a bulge in the abdomen or in the groin. Other patients may have a fair amount of pain in those areas, and yet other patients may present in a more complicated fashion.
Why should you seek treatment for a hernia?
Hernias can become serious if there is involvement of organs such as the intestine. If a loop of intestine becomes trapped in the hernia, the blood supply to that loop of intestine can become compromised, leading to serious complications.
If you think you have a hernia, what should you do next?
If you think you have a hernia, you should schedule an appointment with your primary care provider. At that appointment, they'll examine you and confirm the hernia. From that point on, they likely will refer you to myself or one of my partners. They may also obtain imaging such as an ultrasound or CAT scan.
How are hernias treated?
Since hernias are an anatomic defect in the abdomen or groin, the only real treatment is surgery. A good analogy would be patching a hole in a pair of pants.
What surgery options does Valley offer?
There are a number of ways that we use to repair hernias. The traditional method is what we call open surgery, where we actually make an incision over the hernia and place a patch in that fashion. In recent years, more surgery is turning towards a minimally invasive method, and that's what we call laparoscopic surgery, where a camera is placed into the abdominal cavity, the abdomen is inflated with carbon dioxide gas, and we repair the hernia from the inside out. In recent years, the latest advances are in robotic surgery, where a surgical robot helps us repair hernias in a more sophisticated fashion.
Where have you found the greatest benefit with robotic surgery for patients?
Here at Valley, we have access to robotic technology for hernia surgery. My partners and I have been trained in robotic surgery and have been offering this to our patients for a number of years. The benefits of robotic surgery include an outpatient experience, less postoperative pain, and smaller incisions.
Thank you, Dr. Lau, for answering our questions. And for those of you who are watching, if you're interested in learning more about our general and specialty surgery services here at Valley, we encourage you to go to our website at this link.